video, a woman with kidney failure regains back almost all of her kidney function just thanks to 2 stem cell injections. Yes, restoring kidney function with stem cells is much closer than people think. Catherine here. Today's video is going to be a message of hope. Many CKD patients feel alone and disheartened because they know they are fighting a disease that's not supposed to be curable. But you see, things are going to change a lot sooner than most people realize. Today, science has made incredible steps forward in the field of regenerative medicine, and what was once considered lost forever is not anymore. This is what the story of a 62-year-old woman suffering from diabetes and end-stage kidney disease teaches us. Her kidney disease was advanced. She was in stage 5, and her survival completely depended on a machine. And I'm saying was here because she is no more in stage 5 CKD today. Thanks to a stem cell protocol, she is in stage 3 now and improving. Incredible.
It's not impossible.
Now, this is all documented in a case study published in the BMC journal, an extremely authoritative peer-reviewed medical journal. This is no work of fiction. Now, in this video, I also want to share with you how you could actually access stem cell therapies for kidney disease today. You see, there are several phase 3 clinical trials that are recruiting CKD patients today, and there are also clinics administering stem cells treatments already.
I was diagnosed, my eGFR was 48. Stem cells were the very best chance I had. My eGFR has increased 64, and I was elated at the numbers.
So stay tuned for that part. Before we get there, let's learn a bit more about the 62-year-old woman who completely stopped dialysis and had her kidney function back thanks to stem cell therapy. Because you see, her case is extremely interesting. First of all, because, well, thanks to this treatment, she also gained back the ability to move and feel her legs again. Before receiving the stem cell treatment, this woman, who is suffering from paraplegic condition, wasn't able to move or feel her legs at all. She suffers from a metabolic yield deposit. This is a condition associated with CKD, where the thoracic spinal cord is compressed due to the accumulation of metabolic waste products. This patient wasn't able to move her legs or feel any sensations anymore due to this accumulation. And stage 5 kidney disease with diabetes and paraplegia are not pathologies that have a cure or a treatment. This woman was treated with 2, yes, just 2 stem cells injections. Technically, she received umbilical cord mesenchymal stem cells both in her spine and in via IV. So we are talking about stem cells that have been taken from a human umbilical cord here. And well, the results were incredible. Just 3 weeks after the procedure, the woman started to move her toes again because her serum creatinine dropped from 11 mg per dl to 9 milligrams per dl. But there is more. At the time of the publication of this study, the woman was able to raise her legs again. Her creatinine at that point was just 2 milligrams per dl. What this means is that she went from no kidney function at all, no urine production and complete dependence on the dialysis machine, to just slightly below normal kidney function. I mean, most people don't know they have kidney disease with a creatinine of just 2 milligrams per dl. There are no symptoms at all. This is usually around stage 3. Incredible! But how is this possible, you may ask? And most importantly, how can you get a similar treatment? Well, the way stem cell treatment work in people with kidney disease is pretty amazing. Stem cells are a special type of cell that can basically turn into any other type of cell. They can turn into heart cells, bone cells, blood vessel cells, even kidney cells. And today, we are in the infancy of stem cell therapies. There are various ways in which stem cells can help the kidneys. In this case study, the 62-year-old paraplegic woman received umbilical cord mesenchymal stem cells. These are stem cells obtained from the umbilical cord tissue. And the reason why they are used here is because they have the ability to self-renew, which means they can make more copies of themselves over the months or even years. This is important because this woman was still improving greatly after 8 months from the procedure, which means that the umbilical cord stem cells she received were still turning into, new blood vessel cells, new kidney cells, and more. I mean, this is amazing. Can you imagine it? Just 2 injections and now the stem cells inside you are self-replicating and replacing the damaged cells inside your kidneys. This can go on for months and maybe years. Now, umbilical cord cells are used here also because they have low immunogenicity, which means they are less likely to cause immune reactions when transplanted into a person. Now guys, very interestingly, umbilical cells are not the only way in which stem cells can help CKD patients. There are other studies in which CKD patients are receiving cells from their own body, and this actually solves 2 issues. So, question, what are the most promising stem cells studies for CKD patients? There are many studies that are being done today about stem cells in CKD, and there will be even more in the future because they are actually getting the results. One of the most interesting studies was done in 2019. The study was published on the Kidney International and done on 21 patients who were administered mesenchymal stem cells derived from their own fat, alright. So, no umbilical cord were involved here, and the stem cells were derived from the patients themselves. Now, the most interesting part, on average, the CKD patients that were treated with stem cells in this study were able to have a significant improvement in kidney function. During this trial, 21 patients were able to improve their GFR, main indicator of kidney function, on average from 53 to 56 points. And also to decrease their systolic blood pressure from 144 to 136 millimeters per mercury. And all that with a single stem cell injection, which represents a huge success because this research was focused on patients suffering from CKD and atherosclerotic renovascular disease, or ARVD. Incredible! Question: how does this work? This procedure is not as complicated as it appears to be. Researchers first harvest and cultivate a little bit of stem cells from the patient's own belly fat. And since the stem cells are coming from the patient's own body, there is no risk of rejection and no possible ethical issue either. In the lab, they separate out the tissue's stem cells and enhance their ability to promote kidney function during a 6-week process. Researchers grow the stem cells into the amount needed for treatment, and then they just inject them into the patient's kidney. Yes, it's amazing that this is no more just theory. They have actually done this and documented the results. Now guys, maybe even more incredible, stem cells are being used today to actually farm kidneys for transplant. I mean, I know that this sounds incredibly futuristic, but they are actually doing it. The way this works is by growing a human kidney inside a pig. Now, this is not a modified kidney pig they are going to transplant into a human. You may actually remember how this summer, researchers successfully transplanted a genetically modified pig kidney into a brain-dead kidney disease patient. Well, now they are going one step further. Using stem cells, scientists are growing a human kidney inside a pig. This may sound similar, right? But it's a completely different approach. You see, while this is just a step towards farming human kidneys for transplant, the goal here is not to use modified kidney pigs inside humans. The kidneys these pigs would be completely human kidneys, all thanks to stem cells. Again, I know that this may sound futuristic, but how futuristic will it sound to create a genetically modified guinea pig that could be transplanted into a human? Well, they did that in 2023 already. So the big question is how to access stem cell treatments today? Well, there are actually two ways in which someone with kidney disease could be treated with stem cell therapies today. First of all, a patient could be part of a clinical trial. There are many clinical trials you could be recruited in today, alright? Some of them are remarkable and they need kidney disease patients. This study is one example. They are recruiting patients with stage 3 kidney disease or greater, and the study will be done by the Brigham and Women's Hospital. Their goal? To lower the creatinine levels in these patients by administering kidney-derived endothelial progenitor cells. What are kidney-derived endothelial progenitor cells, you may ask? Well, these are stem cells found inside the kidney. They have the ability to differentiate into several types of kidney cells and also to self-renew. They have already been proven able to actually repair damaged cells inside the kidneys. So this is definitely a very promising trial. They do have some criteria for recruitment though. If you want to get informed and see if you fit their criteria, I've added a link in description to this and all the other clinical trials I will mention. Let's take a look at another very promising clinical trial that's actually in need for kidney disease patients. This study, which is going to be conducted by Mayo Clinic in Florida, is recruiting CKD patients with end-stage renal failure. They are going to administer them adipose-derived mesenchymal stem cells, which is very similar to what researchers did in the study in which 21 CKD patients had a big improvement in kidney function. They are recruiting CKD patients right now as well. Now guys, maybe one of the largest studies on stem cells for kidney disease is going to be conducted at the Bangladesh Laser and Cell Surgery Institute and Hospital. They are also going to use adipose tissue-derived mesenchymal stem cells, alright? This study is actually recruiting right now and they need all kidney disease patients, even patients in dialysis. This is a very promising study with the goal of directly improving GFR or kidney function in the patients. I bet we will hear more about this trial in the future. A different trial from the University of California, Los Angeles is also very interesting. They are going to recruit CKD patients who already received a transplant, alright? Their goal? To liberate the patients from lifelong dependency on anti-rejection medications. Now, what's interesting about this study is that the stem cells are going to come from the same donor that gave the kidney to the patient. So basically, the receiver of the kidney is now also going to receive white blood stem cells from the same donor, and researchers think that this is going to stop the need for anti-rejection medications. Again, all the contacts and info about these trials that are recruiting CKD patients today are down in video description. Okay, now you may ask, I'm tired of waiting. I want a work stem cell treatment right now. Who should I be talking to? Well, there is a way actually to get the stem cell treatment right now that doesn't involve being part of a clinical trial. Because you see, if you take part in a clinical trial, you don't have any warranty of it being effective. You will also need to undergo a monitoring phase during the trial, meaning that you will have to be tested for kidney function and other parameters even more often than you already do. But there is an alternative. You see, today, there are clinics all around the world offering stem cell treatments to kidney disease patients, for a price obviously. This clinic in Mexico, for example, offers mesenchymal stem cell therapy to all kidney disease patients. What they are asking is $8,500 USD for half treatment. Now, I'm not actually recommending you to go to this clinic, by the way. More about this in a moment. Their promise, however, is to stop the progression of CKD by boosting the immune system and helping repair the damaged tissue, renal structure, and body functions lost by the condition. Now, these may seem outlandish claims, for a treatment that consists in a single injection, but given that it's stem cells we are talking about, they may actually be true. They also have testimonials and all that.
I was diagnosed, my EGFR was 48. Stem cells were the very best chance I had. My EGFR has increased 64, and I was elated at the numbers.
This man claims that his GFR was 48 before the treatment, and then it started to raise up to 59.
In 2021 with kidney disease. I was diagnosed in 2021 with kidney disease. When I was first diagnosed, my EGFR was 48. 3, then it went to like 58. And then 60 and 64. I was elated at the numbers. The numbers were fantastic.
There are also other clinics that offers this kind of treatment to kidney disease patients. This one also offers fat cells-derived mesenchymal stem cell therapies. And they also promise you to help you delay or avoid end-stage renal disease. Now guys, I will not leave a link in the description to these clinics. These treatments are still not approved by the FDA today, and I cannot give you any warranties that they will work, because even if we have seen that stem cell treatment can work, there are an infinite number of variables in the way these treatments are administered. So if you are really interested, do a search on Google. Get informed, talk to your doctor, and see what they recommend. This is not a treatment you should do just based on watching a single YouTube video. My advice here is, however, to wait and see what happens. I bet that there will be in the near future a way to get a stem cell treatment at your nearest hospital. This is only the beginning. So make sure you are taking the best care possible of your kidneys and wait for stem cell treatments to be widely available. In this spirit, if you want to know more about what you can do today to protect your kidneys, this video up here is for you, and this is all for today. Thank you for watching. God bless you all. Bye.